The National Education, Health and Allied Workers Union is threatening to go on strike against inadequate PPE for nurses and risk allowances. This comes after a family had to bury their loved one, a nurse who died from coronavirus. Our reporter Masego Rahlaga is following this story. Let's get the latest from her now. Masego, good afternoon. You spoke to the daughter of this nurse who died from COVID-19. How are they coping?
Well, Clement, it's quite a sad situation. I mean, as you know, DENOSA wrote that letter to President Cyril Ramaphosa dated the 11th of September, calling for a number of things. Among those things is basically that risk allowance, because as frontline workers, they risk their lives, but not only their lives, Clement, they also risk the lives of their family members, because they also do go back home to their children, their husband, their grandchildren, you name it. So when I met with Makosazana Tladi, she told me about her mother, who had just turned 55, in fact, Clement, in May. And, she was just describing how sad it is that government doesn't care. In her words, she says government doesn't care about healthcare workers, and over and above that, doesn't care about the families that they're likely to leave behind, because she says that government has promised to give them psychologists to assist them, and till this day, after her mother passed away on the 5th of last month, they still haven't gotten any of this assistance. So it's not even just about the money. It's the fact that, she's lost her mother, her children have lost their grandmother. But here is Makosazana speaking for herself exactly how she feels about being let down by government.
I just feel that our government is failing us, is failing the healthcare workers. If the people who are supposed to save lives of the community, they are being put far in the corner and not being given first priorities to be protected, and you just forget about their families, because of the most sad part is getting to bury a person who died of COVID. You don't find closure. We haven't found closure. Only my sister and my dad had to go to the mortuary to see my mother to make sure we're burying a right person. What about these kids? They last saw her when she was alive. She said she's going to come back. But I pray God will give us strength to get through this.
Masego, that's so sad. She also spoke to you about the difficulty of her mother having already had some health issues.
Well, Clement, that's the sad part about it. The nurse who is fondly known to her patients as Nurse Martha, she had level 2 diabetes, and she worked in the intensive care unit, which is, of course, where the patients who have COVID-19 are sent there. The patients who are at a dire stage of that pandemic are sent to those ICU units of hospitals, and that's where she worked. And because she was diabetic, we've always heard from nurses, from different people telling us that once you have an underlying health condition such as diabetes, it's more difficult to actually heal or be one of those people who recover from COVID-19. In fact, most of the people who succumbed to that pandemic have been found to actually have had diabetes, because, as you know, COVID-19 attacks a lot of stuff in your immune system, and a person who's diabetic also struggles with a lot when it comes to their immune system. So here's what Makosazana said, a conversation that she had with her mom about the possibility that she would die if she actually got that pandemic.
It was something you can never wish for anybody. People have been losing their mother, but it hit home. And my mother was diabetic. She was type 2, and she kept on saying, if I get positive, I won't survive this. I said, no, Mama, you cannot say that you are going to survive this. She said, no, I know I'm not going to survive this because I'm diabetic.